Have you noticed that your eyes constantly feel dry, gritty, or irritated? Do you always need a bottle of water nearby because your mouth feels dry? Perhaps you've developed unexplained fatigue, joint pain, dental problems, or recurrent mouth ulcers. Many people assume these symptoms are simply part of getting older, a side effect of medication, or perhaps just bad luck. However, for some people, these symptoms may be caused by an autoimmune condition called Sjögren syndrome. Sjögren syndrome is one of the most common autoimmune diseases, yet it remains one of the most under-recognized. Many patients go years without a diagnosis because the symptoms often develop gradually and can easily be mistaken for other conditions. In this video, I'll explain exactly what Sjögren syndrome is, the symptoms you should never ignore, how it is diagnosed, and the treatments available. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. Sjögren syndrome is an autoimmune disease. This means that the immune system, which normally protects us from infection, mistakenly attacks parts of the body. In Sjögren syndrome, the immune system primarily targets the glands that produce tears and saliva. As a result, patients often develop dry eyes and dry mouth, which are the hallmark symptoms of the condition. Now, although dryness is often the most obvious feature, Sjögren syndrome is much more than simply a dry eye or dry mouth condition. It is a systemic autoimmune disease, meaning it can potentially affect many different parts of the body, including the joints, nerves, lungs, kidneys, skin, and blood vessels. One of the most common symptoms is dry eyes. Patients often describe a gritty sensation as though there is sand in their eyes. Others complain of burning, stinging, redness, irritation, or blurred vision. Many find they become increasingly sensitive to wind, air conditioning, or prolonged screen use. Some people are constantly using artificial tears throughout the day. Dry mouth is another key feature. Patients often notice they need to sip water frequently. They may struggle to swallow dry foods such as crackers or bread. Some people wake up during the night needing water. Others find they cannot speak for long periods without their mouth becoming dry. Now, this may sound relatively minor, but saliva plays an extremely important role in oral health. Saliva helps protect the teeth and gums, neutralizes acids, and reduces bacterial growth. Without sufficient saliva, patients often experience an increased risk of dental decay, gum disease, and oral infections. Many people are surprised to learn that recurrent dental problems can sometimes be one of the earliest clues to Sjögren syndrome. Patients may develop multiple cavities despite excellent oral hygiene. Dentists are often among the first healthcare professionals to suspect the diagnosis. Another symptom that can be particularly disabling is fatigue. In fact, fatigue is one of the most common reasons patients seek medical attention. This is not simply feeling a little tired. Many patients describe overwhelming exhaustion that does not improve with sleep. Some compare it to having a permanent flu-like illness. Fatigue in Sjögren syndrome can have a major impact on work, family life, and overall well-being. Unfortunately, is often one of the most difficult symptoms to treat and can sometimes be underestimated by others. Joint pain is also very common. Many patients develop aching joints, stiffness, and discomfort that may resemble rheumatoid arthritis. The hands, wrists, knees, and ankles are often affected. Some patients experience prolonged morning stiffness, making it difficult to get moving at the start of the day. Muscle aches can occur as well. Patients often describe widespread aching and soreness that can be mistaken for other conditions. This is one reason why Sjögren syndrome is sometimes misdiagnosed initially. Now let's talk about some of the less well-known symptoms. Sjögren syndrome can affect the salivary glands themselves, causing swelling around the cheeks or jaw. Patients may notice episodes where the glands become enlarged, tender, or uncomfortable. The skin can become dry, the nose may feel dry. Some women experience vaginal dryness, which can significantly affect quality of life. Dryness can affect multiple mucosal surfaces throughout the body. Another important symptom is nerve involvement. Some patients develop numbness, tingling, burning sensations, or neuropathic pain. This occurs because the autoimmune process can sometimes affect peripheral nerves. In certain cases, Sjögren syndrome can affect internal organs. Lung involvement may cause breathlessness or chronic cough. Kidney involvement can occur. Blood abnormalities may be seen. Fortunately, serious organ involvement is less common, but it is one reason why regular monitoring is important. Now, one interesting aspect of Sjögren syndrome is that it can occur on its own or alongside other autoimmune disease. When it occurs by itself, we call it primary Sjögren syndrome. When it occurs alongside another autoimmune condition such as rheumatoid arthritis, lupus, or systemic sclerosis, it is called secondary Sjögren syndrome. As rheumatologists, we often see Sjögren syndrome in patients who already have another autoimmune diagnosis. Sometimes patients initially present with dry eyes and dry mouth, while in others the symptoms develop later. So how do we diagnose Sjögren syndrome? The diagnosis usually involves a combination of symptoms, blood tests, and specialist investigations. Blood tests may identify antibodies commonly associated with Sjögren syndrome, including anti-Rho and anti-La antibodies. We may also see positive ANA tests and evidence of immune system activation. However, it is important to understand that not every patient with Sjögren syndrome has positive antibodies. This can sometimes make diagnosis more challenging. Eye specialists may perform tests that assess tear production and measure eye dryness. Salivary gland function can also be evaluated. In certain situations, a small biopsy of a minor salivary gland inside the lip may be recommended to help confirm the diagnosis. Now let's discuss treatments. Unfortunately, there is currently no cure for Sjögren syndrome. However, there are many effective treatments available to help manage symptoms and improve quality of life. For dry eyes, artificial tears are often the starting point. Some patients require prescription eye drops or specialist treatments from ophthalmologists. Protecting the eyes from environmental irritants is also important. For dry mouth, regular hydration is essential. Saliva substitutes and saliva stimulating treatments may help. Good dental care is particularly important because of the increased risk of tooth decay. Fatigue can be more challenging to manage. Optimizing sleep, maintaining physical activity, and addressing other contributing factors can help. In some patients, treating under inflammation may improve fatigue. If joint inflammation or systemic symptoms are present, medications such as hydroxychloroquine may be considered. In more severe cases, immunosuppressive therapies may occasionally be required, depending on which organs are involved. Now, one question I hear frequently is whether Sjögren syndrome is dangerous. The answer is that most patients live normal life expectancies and do very well with appropriate management. However, it is important not to ignore symptoms because untreated dryness can significantly affect quality of life, and in some cases, complications may develop. There is also a small increased risk of lymphoma in patients with Sjögren syndrome. This is something rheumatologists monitor for carefully during long-term follow-up. Although the overall risk remains low, it is one reason why ongoing specialist care is important. Let's summarize the key warning signs. Persistent dry eyes, dry mouth, unexplained fatigue, recurrent dental problems, swollen salivary glands, joint pain, morning stiffness, neuropathy symptoms, and other autoimmune features should all raise suspicion for Sjögren syndrome. The most important message I want you to take away from this video is that dry eyes and dry mouth are not always simply nuisance symptoms. Sometimes there may be clues to an underlying autoimmune disease that deserves proper investigation. If you've recognized some of the symptoms I've discussed today, it may be worth speaking with your GP or seeking assessment from a rheumatologist. Early diagnosis can help improve symptoms, prevent complications, and provide reassurance about what is causing your symptoms. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. For more videos on autoimmune disease, arthritis, and lupus, please make sure you subscribe to the channel. And if you would like a specialist consultation, I see patients at Pure Rheumatology London. Thank you very much for watching.